Hi and welcome back to another video of Medic Notes. This video will be on Obsessive-compulsive disorder, short form OCD. OCD features a pattern of unwanted thoughts and fears, which is the so-called obsessions, that will lead an individual to do repetitive behaviors or actions, which is the compulsions. So obsessive-compulsive disorder is mainly formed by obsessions and compulsions. And these obsessions and compulsion will interfere with the daily activities and cause significant distress to the person. First, we will look at obsessions. Obsessions are persistent, intrusive thoughts recognized to be the patient's own thoughts, which cause the patient significant distress. And these thoughts can be in the form of doubts, impulses, ruminations, and thoughts, where the patient will attempt to ignore or suppress these thoughts. So first we look at the doubts. It's, for example, they're uncertain about their previous actions, whether did they lock their car door or did they turn off the water tap or turn off the fire stove before going out. Impulses and images are repetitive urges to carry out actions that are usually embarrassing or undesirable, such as shouting foul words in public or mentally seeing disturbing images such as stabbing themselves. Ruminations are repetitive worrying thoughts. For example, they are worrying about the end of the world, which is a more complex thought. And whereas the fourth one, thoughts are repetitive and intrusive words or phrases in their mind. Moving on to compulsions. Compulsions are repetitive behaviors or mental acts, and they are usually associated with an obsession. They have the function of reducing distress caused by the obsession, for example, cleaning, checking, and counting. So to diagnose someone as having OCD, we will need to refer to the DSM5 diagnostic criteria. There must be a presence of obsession and compulsion, or both. It can be only obsession, can be only compulsion, or it can be both obsession and compulsion. And it must have caused much impairment in the terms of functioning in one's daily life. Obsessions are recurrent, repetitive thoughts, urges, or images that are experienced recurrently, and they are intrusive and unwanted, causing marked anxiety or distress. And the individual attempts to ignore or suppress those thoughts, urges, or images. Whereas compulsions are defined as repetitive behavior or acts that the individual feels obliged to perform in response to the obsessive thoughts. And this repetitive behavior or acts are aimed to reduce their anxiety. There is an instrument scale used to assess the severity of the obsessive-compulsive disease, which is the Yale-Brown Obsessive-compulsive scale, and it rates the severity of the OCD symptoms. This questionnaire takes about 15 to 30 minutes to complete, and it is often used to monitor the patient's changes over the course of treatment. For management, we can offer inpatient management if the patients pose a severe risk to themselves or other people, demonstrate severe self-neglect such as poor hygiene or poor eating, extreme distress or functional impairment, or they respond poorly to treatment and requiring compliance monitoring. Then we have to admit in ward to assess their compliance to their medications. Other treatment include pharmacotherapy. The first line medication would be SSRI, which is the selective serotonin reuptake inhibitor, taken over 10 to 12 weeks of trial at adequate doses. And the usual dose to treat OCD is 2 to 3 times higher compared to the dose for treating depression. Clomipramine is another medication that can be considered, and its class is the tricyclic antidepressant. Psychotherapy can be offered, which includes behavior therapy, which is the exposure response prevention therapy. It is a treatment of choice for limiting dysfunction resulting from obsessions and compulsions. And also cognitive therapy, which includes anxiety management, asking the patient to keep a diary of their daily activities, cognitive restructuring, and also coping strategies can be offered to the patient. That's all for this video. Thank you.